Welcome to this presentation over Chapter 1 of the Blausen Complete Anatomy and Physiology Experience. Today we'll be covering Chapter 1. Chapter 1 is divided up into 7 portions, and we will be covering all of those sections in this lecture presentation. So let's get started. As you navigate through the book, I think you will be impressed by the beautiful artwork and the animations and the models that we will encounter. Now, as we go through this, let me just point out that each chapter starts off with chapter objectives. These are global chapter objectives that cover the entire chapter, and this essentially becomes your study guide. You should be able to answer all of these questions or be able to describe any of these things. For example, after this presentation and after reviewing the notes, you should be able to distinguish between anatomy and physiology. You should be able to identify the structures of the body from simplest to most complex. You should be able to identify the characteristics of human life, identify the 4 requirements for human survival, define homeostasis, use appropriate anatomical terminology to identify key body structures, body regions, and directional terms, and finally, know a little bit about the major medical imaging techniques. So let's get started. I will be lecturing directly from the book, and we're going to get started with just what is anatomy? What have you signed up for? You are in a human anatomy course this semester. And so human anatomy is the study of the body's functions and structures. What we'll be focusing on now will be the body's structure. So in the book, if you'd like to, you can take your mouse and just click across. You can then add any color that you like. Now, I will be using the dark blue color for areas that we'll be skipping this semester. So I'm not going to choose that color, but you can choose any other color that you like. There's a lovely yellow. And when you highlight something, it will continue to be there for you the next time that you log into the book. So you are creating a study product. So anatomy, again, is the study of the body's pieces and parts and its structures. And we will spend a lot of time this semester learning hundreds and hundreds of parts of organs and of the body. So the word anatomy means to cut apart. And for hundreds and hundreds of years, bodies have been examined and decisions have been made about the human body based upon those dissected human remains. In anatomy, we can talk about a couple different specializations. One is gross anatomy, not gross like, ooh, gross, but instead gross as in larger structures. Gross anatomy is typically the first course students take in medical school or in physical therapy school or in PA school. And gross anatomy, another way of thinking about it, it is anatomy that you can see with the naked eye. It's macroscopic, it's large. In contrast, we have microscopic anatomy. Now, if we are using the microscope, that is microscopic anatomy. If we are specifically looking at the study of cells, that is called cytology. If we're looking specifically at the study of tissues, that is histology. In our lab 2 this semester, we will spend an entire lab, learning about histology, looking at 20 some different tissues under the microscope, learning about their characteristics and their functions. So if I'm looking at a brain in the A panel, then I'm talking about gross anatomy. If I'm looking under the microscope and I'm looking at the cells that make up nervous tissue, then I am dealing with microscopic, specifically histology in this case. If I'm looking just at cells, that would be cytology. Now, we can also divide anatomy up in a couple different ways. The way this book is arranged and the way that you'll be learning it this semester is systemic anatomy. That is, we will be learning the pieces and parts that make up each of the systems, the body systems. Now, other schools, other Upper division courses in anatomy might approach anatomy more as regional anatomy. In other words, you would look at the structural anatomy of the shoulder. You would not only look at you would look at muscles and bones and the nerves and the blood vessels and the lymphatics and everything about the shoulder, for example, or everything about the knee or everything about the abdominal area. So regional anatomy really is a more advanced approach to anatomy. Now, the counterpart to anatomy, and that will be the focus of the second semester course in this series, is human physiology. Now, human physiology is now figuring out how do all these pieces and parts work together. So, physiology is a study of function, 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 function. And one of the key ideas in physiology, and I'll be introducing this in a few moments, is the idea of homeostasis. Homeostasis is basically the idea that no matter how your environment is, if it's hot, if it's cold, that your body tries to keep a constant body temperature. Um, your body needs to keep its calcium levels, its sodium levels, its magnesium levels at a certain level in order to do things normally within the body. So homeostasis is keeping things relatively within the same range of normal, and that normal range is necessary for the body to function at its full capacity. Now, as we travel through the book, you're going to see a few fill in the blank sort of questions. These are for you to stop and pause and think. So, for this example, what are 3 reasons to study anatomy and physiology? And which one of those most excites you as you begin your study? So, just jot that down and submit that, and that will be there for you to reflect upon as you go back and study. Now, I'm not going to read the entire book to you. I want you to be glancing through and reading this yourself. But the next question I want you asking yourself is, what is or what are your future career goals? And what is an example of how studying anatomy and physiology will be important in your chosen career? Now, one of the great things about this book, and you'll see an example of this in a moment, is that there are over 650 animations strategically placed throughout the text. And as we get into the next section, you're going to see a animation at the very top of the chapter. It is highly advised that you take a few moments to click on those animations and watch them. Take notes on them. I will not be stopping to play those animations during these recorded lecture videos, but I would suggest that you stop and do that. Also, as we're reading through the book, I would recommend that you, if you're listening to this YouTube video, that you are watching my video on one side of your screen, and on the other side of your screen, you have your personal version of the Blausen text open, and that you are following along, answering questions, playing animations, taking notes, highlighting, and interacting with your book. At the end of each chapter, there is a short review section. Again, review those areas. And then at the bottom of each section, there's also a place for you to draw notes or to type out any notes to yourself. In addition to these little spaces where there are notes, you also have a couple other features in the book. You can, at any place in the book, add a note. And so this is a great place to add a question. If something comes up and you're not sure about it, ask that question. You can bring those questions to lab or to lecture or to a study group. You also can, at any place, let's say you don't know or you want a better definition of the word physiology, highlight that word, go down, look it up in Wikipedia, and you will now see the definition and a deeper dive into that term. So any word in the book that you're not confident about, scan it and look up its definition. At the end of each section, also, there are questions for you to consider. I highly recommend that you do these questions. If you answer a question 3 times incorrectly, you will be given the correct answer. If you get the question right in one of the first 3 attempts, then it will be there, and that is the correct answer here in green. These correct answers will stay available to you. So as you interact with these questions and answer these questions, they become a great study tool as you review back through the book. And you can see that I answered these previously, and as I opened up my book, the answers are still there. The rest of them I did not answer. That is your job. There's also some vocabulary comments here at the end, a few fill in the blank questions. Fill in the blanks just give you words to fill in those blanks to choose from and drop down menus. And then now we're in the second section. So by the end of this second section, you should be able to describe the body in 6 levels of organization, and you should become familiar with the 11 organ systems. Some might also call these the 11 body systems that make up you and me. And in each of those body systems, you should be able to, at this very early introductory level, be able to name at least one organ found in those body systems and name one major function of that body system. So here is our very first animation. I am going to play this for the purposes of demonstration. However, I will not be doing this routinely. I highly recommend, however, that you do watch these and take notes.
Some of the basic levels of organization within the human body include organ system level, such as the cardiovascular system, organ level, such as the heart, tissue level, such as cardiac muscle tissue, and cellular level, such as cardiac muscle cells.
Again, these short videos are going to help you visualize what you are about to learn, what you are about to read, and highly, highly recommend that. You can go back and play those over and over. And then following that, you will find an image. Most of these illustrations are going to come directly from the animations and are very, very similar. So here is basically a lovely diagram showing you the levels of organization as we travel through the body. Now, I am going to add a couple of levels of organization to this chart. And so I'm going to add a little note over here on the side. So it's talking about 6 distinct levels. I'm actually going to add a couple of levels. So as we look at this diagram, it starts off at the chemical level. Another way of saying that is the atomic level. So we go from atoms. Atoms are things like sodium, carbon, oxygen. And those atoms are now going to combine to make molecules. So we now go to molecules as the next level. Now, those small molecules are going to then combine to make, in small molecules, things like water. And I'm going to add 2 levels right here. This is where I'm adding in. So those small molecules are now going to combine to make macromolecules. Now, macromolecules are essentially the same thing you read about on a food label: carbohydrates, proteins, nucleic acids, and lipids. So those are your macromolecules. Now, the macromolecules are now the building block of your organelles. Organelles are things like, and that's included here, organelles are things like the mitochondria, the Golgi bodies, the cytoplasm, and all the different organelles found within the cell. And we'll be studying those in chapter 3. The organelles are then the building blocks of cells. Cells then combine to make tissues. Now, in your body, there are about 220 different kinds of cells. Cells are the smallest living component in your body. And those 220 different kinds of cells combine to make tissues. Again, the study of cells is cytology. The study of tissues is histology. And there are four main types of tissues. And again, we'll spend a lot of time looking at those. Those tissues are now the building blocks of your organs. Things like skin, heart, brain, kidney, liver. If I take a piece of skin, I'll be able to find all four types of tissues represented in the skin. If I take a heart, you will soon be able to identify the four different types of tissues in that heart. Same is true of all organs. Those organs are then the building blocks for the organ systems. And then all those 11 organ systems combine to make the organism, you and me. So I oftentimes call this the atom to atom continuum, ATOM to ADAM. So really what I've done is simply added a little bit of detail in between the molecule and the cell level. I added macromolecules and I added organelles. And all of what I just said is now described here in the text, going from the atomic level up to and through the organ system and the entire organism. Here's an activity for you to fill in from the lowest level up to the top level. Now, as you are learning your body systems, there are lovely images in here of each of the systems. Your job is to recognize these systems the next time you see them. Your job is also to know at least one, if not start learning most of the components. So for example, the integumentary system is composed of not only your skin, but also your nails and your hair. And two functions are listed here. There are more, but the main functions of the integumentary system as you start learning about this is that the integument encloses all of your internal body structures. And number two, there are many sensory receptors, nerve endings on the surface of your body that allow you to understand and interpret your environment. We'll see that there are other functions as well of the integumentary system. For example, sunlight, UV radiation hits the skin, and it's there that you begin to make vitamin D for your body. So there are many other functions as well. We will be studying each of these body systems as an entire chapter and sometimes multiple chapters. The skeletal system, when you see bones, make sure that you know that that's the skeletal system. And again, review the functions of these systems. There are universal colors that are typically used to describe different body structures and different body systems. When you see yellow, it is oftentimes, not exclusively, but oftentimes related to the nervous system. Nerves are oftentimes shown as yellow structures. Muscular system, all the muscles of your body. Muscles not only help you move, but also help you maintain your body temperature. Cardiovascular system, here you'll see red and blue. Red representing oxygenated blood, blue deoxygenated blood. This is going to include all the blood vessels in the heart. This movement of blood is also going to help stabilize your body temperature, delivering oxygen and nutrients to your tissues as well. The endocrine system. The endocrine system is going to include all of the glands that release hormones into your body. Endo means within, crine means to secrete. So there are glands up in your brain called the pituitary gland, thyroid gland in your throat, adrenal glands, the pancreas, the testes and the ovaries. All of these are major endocrine glands, and we'll be discussing them later in the semester. Lymphatic system is historically shown as green. When you see green vessels, these are not miscolored blood vessels, but these are lymphatic vessels, and they are carrying lymph. Lymph and the lymphatic system is a major part of your body's ability to fight off infection. Respiratory system, when you see the lungs and you see some of the nasal passages highlighted, that is going to be the respiratory system. When you see the stomach, the intestines, the liver, the esophagus, this is the digestive system. And when you see the urinary system, that is kidneys, ureter, bladder, and urethra, that is the urinary system. It is filtering blood, creating waste products. And then finally, the reproductive system, both the female and the male versions are here. Both are producing sex hormones, both are producing gametes. In the case of the female, those are the eggs. In the case of the male, that's the sperm. And the female reproductive system is also producing milk, lactation, and you get the idea that each of these pictures is unique. You need to study these and recognize them when you see them again. And that's the end of section 1.2. There are some questions for you to consider here at the end. Again, by answering those questions and confirming your understanding, you will be far more prepared for the major exams in the course. Section 1.3, moving on. Here we're going to be taking a look at the organization. Again, understanding the organization we just discussed, understanding the term metabolism, anabolism, and catabolism, understanding how the body responds to its environment, and finally understanding some of the characteristics of life, such as differentiation and reproduction. So now this is a human anatomy course, so we're dealing with human biology. We're dealing with a large organism, you and me, but all living things, even one-cell organisms like bacteria, are highly organized. So all living things are highly organized. As humans, we are composed of trillions of cells. And those trillions of cells all work together to help maintain our overall well-being, our homeostasis, our overall metabolism. We just talked about that hierarchy from atom to atom. You see that we are highly organized. All living things take in energy and use it. And that overall definition is metabolism. Metabolism is all of your chemical reactions that take place in your body. Now, those chemical reactions come in two main flavors. One, anabolic reactions. Anabolic are when you build things. So you've heard of anabolic steroids. Anabolic steroids are taken to build muscle. That's probably a common understanding. So when you hear the word anabolic or anabolism, you're considering how small things are put together to make larger. So we are assembling things. And whenever we assemble molecules, we must use energy. And the energy that we use is what we eat. So we eat food, our body uses that energy to build up larger molecules from the simpler pieces, and that is anabolism. Now, catabolism is a process the opposite. It's where we break things down. So catabolic processes are where we take more complex things and we break them down into smaller pieces. When things are broken down, energy is released. So when you eat something, your body is going to take it in, it's going to break it down. In that breakdown, we're going to release energy. That energy is then going to be used by the body to build up the necessary molecules that sustain your life. So if we take a look at this picture, this big sphere here could either be, think of it as your entire body, whereby you are bringing food in through your digestive system, and as a result of catabolism, you're breaking those molecules down into their simpler pieces, and then your body and different cells in your body are then going to utilize that energy, undergo anabolic reactions, and now build the complex molecules that it requires. So you can think of this big sphere as being your body, or you can think of this sphere as being a single cell. You have trillions of cells in your body, and each and every one of those cells is doing its own metabolism, right? So every cell is taking in energy and using it to build things. So every cell is highly organized. Every cell has a metabolism. Every living thing, right? When I say every cell or every living thing, it's the same list. Every living thing is responsive to its environment. So when you are hungry, what do? You seek out food. When you are hot, what do? You seek out shade or something to drink. When you are cold, what do? You seek out shelter or you start to shiver to help maintain your body temperature. So, as a living beast, you respond to your environment. Each of your cells internally also responds to its environment and also can change. So, blood vessels can dilate, sweat glands can release. We get the idea muscles can contract or they can relax. So, there are many, many things happening in your body that respond to the individual environment. Living things move. Now, um, individual cells move, organisms move. So in our body, we have muscles that help contract. In our body, we have blood cells that move through our circulatory system. We have electrical signals that travel through our nervous tissue. We have food that is pushed through our digestive system. We filter our blood and we make urine and we release that from our body. So our body is constantly moving things through it in order to help maintain life. And all living things are going to develop. All living things have a life cycle. We have a life cycle. Our life cycle starts at conception when egg and sperm come together. That is the beginning of human life. All living things then are formed and grow from that earliest point, and then living things, in order to reproduce more of themselves, must reproduce. Now, reproduction is not a necessary role for you as an individual. We don't have to reproduce, but the cells within us are constantly reproducing in order to maintain our overall homeostasis. So that comes to a quick end to section 1.3. Again, answer these questions to make sure you're understanding what's going on. And now let's take a look at the requirements for human life. So, human life, we require oxygen. Don't make this really hard. This totally makes sense. As living human beings, we require oxygen. That oxygen is coming from the atmosphere. The air that we breathe in is about 20% oxygen. Now, it's not the only thing we're breathing in. We're also breathing in nitrogen gases and everything else, but oxygen is the most likely. You know that without oxygen, our cells become quickly deprived, and that death follows shortly after the lack of oxygen. Some tissues are even more prone to that lack of oxygen. For example, oxygen, if the oxygen does not get to the brain, we suffer brain damage very quickly. If we don't have oxygen going to our heart muscle, to our heart, then our heart muscle is also damaged rather quickly. All of our body requires nutrients. We get this from our food and our beverages. We certainly take in water. We need to have water. We need to have energy yielding and body building nutrients. This is the food that you're eating. And in your food, there are micronutrients, think vitamins and minerals, that are also necessary for your body to work on all functions. So I think we get the idea that our body needs oxygen and our body needs nutrients. But another thing is that our body, in order to survive, needs to survive within a relatively narrow range of temperatures. Our body cannot withstand super low temperatures or super high temperatures. Yes, we can for short periods of time, but after a relatively short amount of time, our body can no longer survive in super hot or super cold temperatures. Throughout the book, there will be these little vignettes, these little stories to read. I definitely ask you to read through those. They'll give you a deeper understanding of some of the things that we're describing here. And then, lastly, and probably even least thought about, in order to survive, your body needs a narrow range of atmospheric pressure. Everywhere on the planet where we can live, we have about 20% oxygen, but we also have atmospheric pressure. That atmospheric pressure is necessary to push the air into our lungs. And if we go to a place high in the mountains, there is less atmospheric pressure. There is the same amount of oxygen in the air, but when you go to high altitudes, there is less of this atmospheric pressure, and that causes less air to be pushed into your lungs, and therefore your body senses that it isn't getting enough oxygen. Now, our body can adjust to those higher altitudes, and it does so. We'll talk more about that when we get to the respiratory system later in the course. But for now, know that our body requires oxygen, nutrients, temperature, and pressure within a relatively normal range in order for you to survive. Again, review these questions. And now let's talk about homeostasis for a moment. So, homeostasis is this idea that the body is constantly monitoring its internal conditions and trying its very, very best to maintain that level, not at a perfectly straight, constant level, but within a normal range. We call that normal value the set point. And then the range is that fluctuation around that set point. Let's think for a moment like a thermostat in your home. You set the thermostat, let's say at 70 degrees. That's the set point. That is the goal of your thermostat and your heating and cooling system, is to keep the house at 70 degrees. But you know that your house is not going to stay at exactly 70 degrees. If it's winter and you open the windows or just have poor insulation, you know what's going to happen. The temperature in your house is going to drop. And at some point, it will drop to a point where the heater will click on. And the temperature in the home will then rise. Now, it won't stop at 70 degrees. It'll go a little bit warmer than 70 degrees. And when it gets up a little bit above 70 degrees, it will then click off. And then again, we'll start to drop in temperature. So we're going to fluctuate around that normal range, and that is typical in healthy normal ranges. Now, when your body can no longer maintain that normal range, we're going to see the doctor. If you can't maintain your blood sugar, you might have diabetes, and you're going to go see your doctor. If you cannot maintain your body temperature, you have issues. If you can't maintain your body sodium levels or your body's blood pressure or any number of other tightly regulated things, then you might have some disease state or some condition whereby your body can no longer maintain its homeostasis, and there's going to be a diagnosis that is used to describe that lack of homeostasis. Now, negative feedback is the very mechanism that makes this homeostasis work. So basically, negative feedback is what helps to maintain your body within those normal ranges. So we can look at this diagram, thinking about it again. This is basically your control center for your temperature in your body. So you have sensors in your body you have a control panel, and you have something that happens in response when things go out of control. So, for example, if your body temperature exceeds 37 degrees Celsius, then cells in your brain and in your skin are going to sense that. That sensation is going to go to the regulatory areas in your brain, sort of like your thermostat, and then it's going to kick in the sweating of your body to cool off. And so we have this negative feedback that's occurring. If instead our body temperature was dropping, we would instead start to shiver or move around to move our muscles to create heat. Now, if there's a negative feedback, there must also be a positive feedback. And here's a great video to review about negative feedback. But you'll learn if there's a negative feedback, there's probably also a positive feedback. So let's take a look at an example of positive feedback. Now, there are very far fewer examples of positive feedback. Positive feedback is when a deviation, when something starts to change from the normal range, and rather than the body trying to correct it, instead, the body keeps going and keeps going and keeps going until it reaches a final point. Now, one classic example of positive feedback is childbirth. If a woman goes into early labor, there is no way that her body itself has the ability to stop that labor. The woman is put on bed rest or maybe on some medications to try to slow down that early labor. But basically, when childbirth does kick in, it is going to go to completion, ready or not. So that's one example of positive feedback. Now, it may not be a positive outcome that a woman goes into early term labor. Another example of a positive feedback, and here's a video on this, is blood clotting. Blood clotting, once blood begins to clot, it goes to completion. It goes to the end of the cycle. The body really doesn't have a way of stopping it once it starts. So we need blood clotting, normal blood clotting, to stop ourselves from bleeding out if we cut ourselves. That's a normal, healthy response. But also think of the other way around. Some people throw blood clots in excess, and those blood clots can go to the lungs or to the brain or to other organs and cause catastrophic or even death. And so we see that when a blood clot starts, the body wants to finish it, right? It wants to stop the bleeding for like a cut to the surface of your body. But internally, when a blood clot starts, it also will go to its normal completion, and that is not always a good thing to happen. So the examples of of positive feedback, classic examples are blood clotting and childbirth. That's the end of the homeostasis section. Now, answer a few questions. Let's take a look now at anatomic terminology. Now, this section of the book, I'm going to go through very, very quickly. There's a lot of information here, but this information is essentially identical or highly, highly correlated with what you are doing in Lab 1. In Lab 1, you are learning about anatomic position. You are learning about directional and regional terms. You're learning about the three main planes used to study anatomy. You are learning your directional terms like dorsal and ventral. You're learning about your body cavities. You're looking at the different divisions like the hypogastric and the umbilical regions. And then finally, you're learning about the serous membranes. And so this section, 1.6, is highly practiced in your first lab. And so I'm going to go through this quickly, and you are going to spend a deeper dive watching your lab content and studying that this week. So we start off with anatomic position. You are learning that anatomic position is the body standing upright, feet at shoulder width and parallel, toes are pointing forward, The upper limbs, the arms are down, palms are facing forward. So this is your classic view, classic description of anatomic position. Let me ask you, is this guy in anatomic position? If not, what is wrong with this image? What is wrong with this image to make it anatomic position? If there's something wrong here, go ahead and jot it down here in this spot, and let's talk about that in lecture or lab. Now, as we look at the body, there are dozens of names for different surface features of your body. Many of these terms we know from kindergarten, but we are going to be using anatomical terms when describing these regions. So no longer will you get credit for saying neck. You now need to say the cervical region. No longer will you get credit for saying chin. You will now say the mental region. No longer will you get credit for saying the nose. It is the nasal region. The orbital or ocular region for the eye, the frontal region for the forehead. You get the idea. The upper arm is the brachial region. The antebrachial region is the forearm. Your wrist area or the carpal region. We'll refer to the patellar region for your knee, the crural region for the front of your lower leg, the tarsal region for your ankles, the femoral region for your thigh. And from the posterior side, we'll use the word acromial region for your shoulder, olecramal region for the back of your elbow, lumbar region, gluteal region, popliteal region, the back of your knee. The sural region is what you would normally call your calf. Calcaneal region would be your heel. So make sure that you are using these anatomic terms when describing regions of the body. Some of these are familiar, some of these are going to be brand new for you. So make sure that you're learning those. In addition to anatomic position, I want to make sure that you also know prone and supine. These are also introduced in lab. Prone describes a face down orientation. Supine is a face up orientation. Imagine someone laying on the ground or in bed. When we are describing these regional terms and when we're looking at even a heart or a brain or a kidney, we're going to use a number of directional terms. Anterior and posterior can be interchanged with ventral and dorsal. Anterior toward the front, posterior toward the back. Superior and inferior. Superior toward the top, inferior toward the bottom. You will also see, especially when we get to fetal pigs and four-legged animals, you will see cranial and caudal used toward the head, toward the tail. Lateral and medial, very commonly used. Lateral to the outside, medial to the inside or toward the midline of the body. Remember, we're thinking about the body in anatomic position when we apply these terms. Proximal and distal. Proximal, closer to where the arm or leg attaches to the rest of the body. Distal, a greater distance away from that point of attachment. Proximal and distal will only be used when describing the arms and the legs, the upper and lower extremities. Superficial and deep have to do with how deep something is to the surface of the body. So a deep wound or a more superficial wound. Planes of section. Sagittal plane. Sagittal plane is going to divide something into right and left portions, not necessarily the middle, right? A sagittal plane is any infinite number of slices of the body. Now, this could be the whole human body, or this could be, I hand you a heart and I say, now slice the heart sagittally. You are going to imagine that the heart is sitting in your body in anatomic position. And then you would imagine how you would slice the heart into right and left sides. If there is a mid-sagittal, That is the theoretical perfect middle, down the perfect middle of that organ or the body. Usually, sagittal, we'll just say sagittal, but you might just see parasagittal. Again, watch these videos for reinforcement. Frontal. Frontal plane, also called coronal. This is when you are creating front and back sections, anterior and posterior, ventral and dorsal sections. And then the transverse plane, this is dividing the body into upper and lower, superior and inferior sections. This is also called cross section. It's also referred to as horizontal. So let's highlight those. Horizontal, transverse, these are the same thing, as is cross section. This figure helps to imagine how the human body could be divided. But again, these are just one of an endless, infinite number of slices that could be done through the body. So we've talked about the outside of the body. We've talked about how to slice up the body. Now let's dive inside the body. And here we're going to see some cavities. From a lateral view, from a side view, we can see the cranial cavity and we can see the spinal canal, the vertebral canal. And those, I think you agree, are toward the back of the body. So those are dorsal body cavities. And then in the ventral body cavities, we have the thoracic cavity, where the heart and lungs hang out. We have the abdominal cavity, where most of the gut organs hang out. The pelvic cavity, which includes some of the reproductive and urinary structures as well. From an anterior view, we can see, again, all of these cavities. The purple represents the pleural cavity. Now, the pleural cavity is where the lungs are hanging out. The pericardial cavity is containing the heart. The abdominal pelvic cavity is containing your viscera, your abdominal viscera, your intestines, liver, stomach. All of those organs are in the abdominal pelvic cavity. We can divide the abdominal pelvic cavity up into 9 regions. We went over this in lab. So the umbilical region is in the very center of our tic-tac-toe board. If we go lateral, we're in the lumbar regions. These lumbar regions can also be called the flank regions, not as commonly. Epigastric, go superior to the umbilical region in the epigastric region. Go lateral to that, you're in the right and left hypochondriac regions. Remember, the diaphragm is the muscle of respiration, and it is where I'm sort of highlighting now. And the rib cage would be there as well. So the abdominal pelvic cavity goes up underneath the rib cage more than we probably consider when we think about it. And then we go inferior from the umbilical region. We're in the hypogastric region. This is also referred to as the pubic region. Lateral to that, we have the inguinal regions, and some books refer to this as the iliac regions. The Green Lab Manual does that. We can also more simply divide the body up into 4 quadrants. Keep in mind, though, right and left are referring to not what your perspective is, but to the right of the patient or to the left of the patient. As we dive into our cavities, we're going to see that there are 3 serous membranes. Serous membranes are thin epithelial membranes. They are made of 2 layers, and they are going to help surround and protect our internal organs, creating a little bit of a space for some fluid that's going to act as a lubricant. It's also going to help reduce heat buildup as these organs slide and move and beat and expand over each other. So watch these videos on the serous membrane, this one specifically about the pericardium. Here's a great visual of the pericardium. Your fist in this represents the heart, and you're punching your fist into a balloon. And the balloon now has 2 layers. The layer that is shrink wrapped right up against the heart, the fist, would be the visceral layer. And then the layer around the outside, that would be the parietal layer. Same thing with the heart, same thing with the lungs, same things with your gut organs. The heart is surrounded by a double layer, the pericardium. The visceral layer is shrink wrapped to the heart itself. The parietal layer is more outside of that. There is a space in between, referred to as the pericardial cavity, that is filled with fluid, again, protecting, creating a lubrication, and working against the building up of heat from the constant beating of the heart. Around the lungs, similarly, there's the pleura, and around the gut organs in the abdominal pelvic cavity, likewise, there's the peritoneum. So answer these questions to confirm your understanding of these terms, directional terms, lots of labeling in this section as well. So this will be a very, very helpful section for you. Lastly, for this chapter, part 7, we're going to look very, very briefly at medical imaging techniques. Now, you're clearly not going to become an expert in the next 5 minutes. However, I want you to have a basic understanding of what is an X-ray and why are X-rays important? What do they show? What are their advantages? What are their disadvantages? And then finally, what kind of energy is it that is used to create these medical images? So let's go through this again very, very briefly. But an X-ray, we've all probably had an X-ray. This is a very high energy electromagnetic radiation that is used. It is able to penetrate through solids. And when we look at an X-ray, and there's a lovely video here, but when we look at X-rays, we see a negative image. So we see the bones, and we can see fractures of the bones, as in this particular image. Now, the problem with X-rays is that you are being exposed to a significant amount of radiation. And so while the amount of radiation has been reduced over the years, we have more efficient equipment, we still want to be mindful of the number of X-rays that we're having. One of the most significant disadvantage, however, is that if you are taking an X-ray of your wrist, of your 8 bones in your wrist, your carpals, those bones can overlap each other. Or if you're getting a dental X-ray, teeth can block each other in the X-ray. So it's important that you have to get different views of your wrist or of your mouth in order to see all of the teeth or all of the bones. And then the other disadvantage is for the person who is administering the X-rays. They need to be mindful of their total exposure. Now, even more powerful are CT scans or tomography, computed tomography. Now, this is like an X-ray, except you are getting a massive amount of X-ray in a CT scan. But with the help of the computer, it is able to break those images not into a single view, but into a series of views. So the major disadvantage is that you are getting a very large dose of radiation. Okay, very, very large dose. In fact, we know that in many, it takes many years for cancers to develop, but we know that kids who have to undergo a lot of CT scans are at an increased risk of cancer later in their lives, as are adults who have had many, many CT scans. But the advantage is that because the computer's helping, we can see slices, serial slices through the wrist or through a bone, and we can see much greater detail. Moving on, we have MRIs, magnetic resonance imaging. Now, in this situation, it's also a non-invasive technique. Here you are using incredibly powerful magnets. So as the name suggests, magnetic, it is MRIs. They're using strong, strong magnets. And those strong, strong magnets are actually helping to rearrange some of the negative and positive charges in your body, which is then leading to an amazingly great image specifically for soft tissues. So MRIs are great for looking at brain, looking at other organs like a pancreas, or looking at digestive structures. Very, very good. Also looking at softer structures like joint structures. MRIs are fantastic. The negatives is that the person cannot have any metallic implants in their body, as the strong magnet will pull those internal devices out of them or can damage them. The other disadvantage, although that's being relieved now with new technology, is that typically in the old MRIs, the patient had to go into a very tight donut-shaped structure, and that could cause some claustrophobia in some situations. Now they have open-ended MRIs. Two more. We have PET scans, positron emission tomography. In PET scans, the energy that is being used is radioactive chemicals. And so now we're going to use radiopharmaceuticals. That's just a fancy word for things that are radioactive glucose, for example. And so we're going to use PET scans, for example, when we want to look at how alive a tissue is. So if you have a heart attack, you might know that a portion of the heart has gone without blood flow. There's been a burst or a blood clot that has gone to the heart. And as a result, a portion of the heart has not received oxygen for a time. That portion of the heart that dies in that heart attack will not recover. Heart does not have the ability of recovering. And so that tissue, those cells that were damaged, that part of the heart will remain as a dead space in the heart. Those heart muscle cells can no longer contract and do useful work. If you do a PET scan, you're going to give a person radioactive glucose. And then after a few minutes, you're going to scan their body looking for hot spots or cold spots. Now, glucose is energy taken up by all cells in your body. So all living cells are going to take up some of that radioactive glucose. Cells that are dead, like a damaged heart or like a brain after a stroke, are going to show cold spots. And so if a person has had a stroke or a heart attack, those regions will show up as a dark spot because those cells are not taking up the radioactive glucose. Conversely, if a person has a tumor, then cancer cells are faster growing, and they're going to take up an abnormally large amount of that glucose, that radioactive glucose, and they're going to show as a hot spot on the PET scan. And then finally, we're going to look at ultrasound. Ultrasound is an amazing technique in that we're using sound waves, right? We're using the same technology that the Navy uses to look for sunken ships on the bottom of the ocean. And the great thing about it is that ultrasound is going to give us beautiful images. We typically think of ultrasounds typically done about the 20th week of pregnancy for that lovely image of the baby, but it can also be used to look at an enlarged pancreas or stomach or bladder. It is a great technique in that it's very, very safe, even for the unborn baby, and has very few side effects. So look through the different techniques, get an idea of their advantages or disadvantages, specifically know why they're used. The examples that I gave you are what you need to know. And that does bring us to the end of chapter 1 and 2 of this chapter. Now, also, when you are in the book, not only can you scan a word and look it up, but at the back of the chapter, there's also key terms. You can always, while you're in your book, do Control F and search for any word as well. And I search for the word gallbladder, and it will now pick up every place where gallbladder is in the book. So you have all sorts of search tools and tools that you have at your fingertips as you are using this book. And that brings us to the end of Chapter 1.